Welcome to the APMA Residency Interview Roundtable. I am Molly Judge, and I'll be your moderator. I'm from the Ohio area, and I'm the Director of Resident Publications and Research Projects for the Mercy Foot and Ankle Residency Program in Cleveland, Ohio. Our guest speakers here, Dr. Vincent Hetherington to the far right, Dr. Colleen Napolitano, and Dr. David Yeager. I'll allow them to introduce themselves before we begin this interview process.
Thank you, Dr. Judge. It's a great honor and privilege to be here and be able to communicate with the future students and future residents of our program. I'm David Yeager. I practice in Dix, Illinois at KSB Hospital. I'm residency director now for over 3 years. Some of my past accomplishments are including past president of the Illinois Podiatric Medical Association and then also past chairman of the American Society of Podiatric Surgeons.
And I'm Colleen Napolitano. I practice in Maywood, Illinois at both Hines VA Hospital and Loyola University. Been the program director at Loyola University Medical Center for 2 years for our podiatric medicine, surgery, and reconstructive rear foot and ankle program.
Hi, I'm Vince Hetherington. I'm the Senior Associate Dean for the Kent State University College of Podiatric Medicine, and I'm affiliated with the University Hospital, Richmond Heights Medical Center, Kent State University College of Podiatric Medicine residency program.
Very good. So it's an honor and a privilege to be here amongst this faculty. And we're taking a step back here, and we're looking at this process as one that will benefit our medical students in the field of podiatry. And looking towards their residency program, we're thinking of things that are fundamentally important to them as they consider interviewing at their potential residency locations. Now, Dr. Yeager, is there a clerkship that is required to be an interview candidate for your program?
Not necessarily, Dr. Judge. We do give heavy emphasis on people and students that actually visit our program for a month at a time. The way that I envision the clerkship is it's an interview month. Do I give preferential treatment to those students that spend a month with us? Yes. The way I look at that is if I'm going to spend 3 years of my life with someone, I would like to get to know them not only socially, but also personally, and then also educationally as well. And so that month gives me the opportunity to get to know them on those 3 levels. Now, does that exclude people that come and visit? No. Does that exclude people that actually are interested and come maybe spend a week or so? No. But it does give the people that come in for a clerkship for a month the opportunity to have a greater advantage than those that just visit or visit for a very short time.
And Colleen?
My program's a little bit different because we are a mandatory clerkship for the Scholl College or Rosalind Franklin. So although you don't have to do the clerkship to get the program, it definitely is a distinct advantage doing it for the same reasons that Dr. Yeager just pointed out. You have a month to really see somebody and get to know them. But we've also, right now, one of our second-year residents is somebody who visited and actually kept in touch with the attendings that they worked in the clinics with and up to date on some of the patients that he saw. So there is a distinct advantage for doing the clerkship, but again, it's not exclusionary.
Okay. Well, we know that not all programs have or require clerkships, and some programs are fundamentally different than others. And Dr. Hetherington, can you clarify for your program?
Our program, the students that do the clerkship are definitely at a distinct advantage. But in reality, we don't really have an open clerkship. Our students do the bulk of their medical rotations currently through the university hospital system. And all of our students obviously rotate through the college clinics. So for our residency program, the selection committee really consists of clinical faculty from the college and clinical faculty from the hospital. And it's more based on student performance during their clinical experiences. And it's a committee decision that decides how we select our residents. So it is very similar to what Colleen was saying in the sense that it does serve as a site for training of the college students because of the amount of students that have the opportunity to rotate through the university hospital system in medicine, wound care, emergency room, those types of experiences.
Okay. Now, we'll start with you, Colleen. Do you use any kind of filtering methods before you select a candidate for interview, or do you take all comers?
No, we can't take all comers because last year we had over 170 applicants. So when we go to start to do the narrowing of candidates, the first thing I do is pass out all the applications to not only the other attending staff, but also my residents. Because the character, we look for three things: character, competence, as well as chemistry. And so when we have somebody who just, for whatever reason, didn't work well with other people, they're automatically eliminated. And that's from even nursing staff. If they've said, oh, this person, we take everybody in. So that's the first line of narrowing the selection. If there's somebody who hasn't really visited, but they're exceptional when it comes from a different school, with that I end up looking at class ranking versus GPA, because I find with the way the transcripts are right now with the different programs, that it's too difficult to really know what one GPA at one school means compared to the other, and that's where I go with class ranking.
Sure. And Dr. Hetherington, what are your thoughts on that?
Well, what we look at is, as I was mentioning before, how they fit within the environment when they were in their senior year. And so a lot of it comes down to what their character was like, what their motivation was like, how they interacted with members of the staff and the residents, not just the podiatric residents, but the medical residents as well. So I think that's one of our main criteria. But the other thing that we look at, and I think students need to be aware of this for all programs, is there something in this student's educational background, history, that makes them stand out? You know, what I get often from students, you know, in my position at the school is, you know, they tell me, well, Dr. Hetherington, I passed my boards, I passed my courses. You know, why didn't I get a residency program? Everybody that's in the applicant pool has passed their boards and passed their courses. What makes you stand out? What have you done above and beyond just sort of meeting the criteria to graduate? And that can be anything from service-based to the community that's involved. It could be service-based and leadership roles within the institution, within the college, or it can be different types of scholarly activity, whether it be research or writing articles. So we look at that as an additional factor.
So a low GPA is not exclusionary for your program?
Not necessarily.
And Dr. Yeager, what are your thoughts on that?
You know, I can't really add much in terms of what Dr. Napolitano and Dr. Hetherington added. I think one thing that I do ask students on the very first day that I meet them is I ask them, tell me something about you that I would never guess. Tell me something interesting about you. Not that, oh, I like movies. Well, okay, great. You know, so does everybody else. Tell me something that makes you, and like Dr. Hetherington alluded to, that makes you unique. And that is an opening conversation, because the way I look at it, it's a month that we're dating, so to speak, okay? And so now, tell me something that is very inviting about you that I would not guess. And then it lowers the walls of, I'm nervous about, oh, you're the attending. Big deal. Tell me something that interests us. I can say, oh, I did that too, or we can have a communication. And it's, you know, we're all working together to better our patients. That's the bottom line. So tell me something that I wouldn't guess.
Okay, so again, a mid-range GPA is not exclusionary.
It's not. And in fact, you know, as residency director for the third year now, during our first year, we took everybody and interviewed everybody, and that was crazy. So we do have some criteria in terms of our GPA, but that does not exclude somebody. We all have certain things that happen during our careers in terms of academics and that can influence our overall GPA. And so I think there's phenomenal candidates that are out there that might not have the higher GPAs, but that have the personality, the drive to become successful physicians, and that's what I look for.
Okay, so what I'm hearing between the lines is work and self-motivation, initiative, how you work with others. These are key criteria that these residency program directors look at as primary strengths in their residency candidates. How much value does research participation or publications have in determining whether a candidate is granted an interview? Is that a baseline criteria for any of your programs? We'll start with you, Colleen.
It's not a criteria for an interview. It's something that, that we do ask during the interview, like, do you have any research goals? If somebody's done research, we definitely ask them to explain it, and we explore it more. So I think it's an additional factor, but it's not, again, a sole factor on whether someone is or is not granted an interview.
Dr. Yeager, what are you thinking in that category?
You know, I tell students that I look at their CVs, and if they're going to mention research on their CV, I'm going to ask them about it. And I'm not going to say, oh, tell me a little bit about, and they, you know, the research, and if they say the 35,000 feet level, I'll be like, how heavily involved were you? They're like, well, if you're not heavily involved, don't put in your CV, because I'm going to ask you about it, because that interests me. Now, is it a requirement for my program? Absolutely not. But there are tons of companies that come to us that are interested in residency research. And you know, now the national ASPS conference, we all give the students an opportunity and the residents to gain confidence in their speaking skills, gain confidence in interaction with other doctors and possibly future employment. And really, the more that you articulate your views, the better off you're going to be with your patients. And so I tell students in terms of research, no. Is it a requirement? No. Is there opportunities when you're a resident? Absolutely. And if you have the opportunity to do it as a student, it'll give you better advantage as a resident because you've had some experience in formulating how to do research. So it's not a strict requirement for me. Do I like the residents to do it? Absolutely. But I don't require it.
If a student is unable to visit your program as a clerk, so they're unable to give you a solid block of time, is there another method that they can visit or participate at your program and in a meaningful way to boost their potential for becoming a resident at your program? Dr. Yeager?
Absolutely. That's a great question, Dr. Judge. I mean, every Tuesday morning we have, it's called Journal Club, but it's more PIMP session. And I really look forward to Tuesday mornings. And so if the student is going to come and visit, I recommend them coming on Tuesday morning, having a journal article. That's their one day, their 8 hours to 10 hours day that they can splash. And it's important that they make contact with myself, Dr. Palmer, my associate, as well as the staff, because one day can make or break you. And you have to make a distinct impression. I think some students go into, well, I'm going to visit for a day and then I'm automatically going to get an interview. That's not the case.
Sure.
So I think it's important to just become strong, come prepared, and be eager to learn.
Dr. Hetherington, is there any chance that a potential candidate could break down the walls, somebody from another or out of state?
I mean, we encourage people to come visit. You know, that's definitely, even our own students that may not have that, do a medical rotation somewhere else and are interested in the program. We recommend that, we know them at the college, of course, but we recommend that they do schedule time and go out to the hospital and visit the staff out there as well. So we encourage that. Pretty much we're, you know, we primarily take from our own candidates. As you were mentioning before, we don't interview because we know the candidates, but we do look, as a lot of other programs do, for any type of activities above and beyond just going to class and meeting the requirements. You know, we look at clinical evaluations especially, but also for the research aspect of it. And one of the things that I tell students, and I think this is what David might have been referring to, is don't ever pad your CV with a research project. I mean, there's students who always say, I want to do research, and they show up once, and they never come back, but it ends up being on their CV. And I said, because it does two things. One is, somebody's going to ask you about it, and you really better know it in detail. And if you don't, that tells them something right away. The other aspect of it is, if you've done research and you've stayed up with it, if they ask you that question, that kind of takes the interview and puts it in your hands and allows you to shine. So I think if you were to list research or publication or anything that you were working on, it has to have something that had a time commitment to it, that you did put that effort out, and that you really understand the topic area that you were working on. Obviously, a poster presentation or a publication is a great thing, but it shows above and beyond work and initiative and that I look for. And especially if you ask them about it and you could see, many students say, well, I did this. And you could see them come alive in it. You know that, it's something that they really enjoyed and they obviously enjoy self-directed learning and that type of thing, because you need to be that type of person in order to do the research.
And just to piggyback on what you're saying, Vince, is like, you're exactly right. You control the interview from that perspective. Now, let's say you have a 15 to 20-minute interview. If you can speak on your research for 5 to 10 minutes, that's 15 more less minutes, or 10 minutes that you have less for questions that you get asked.
Mm-hmm.
And so now you're much more impressive during that 10 to 15 minutes that you know everything about than opposed to something you might not know much about. So I totally agree with you.
What do you think about some of the resumes that cross your desk where the medical students are indicating that they've participated or written for journals that are not peer-reviewed in any way? They're writing a paper for a throwaway journal, but they have a litany of projects that they've done. How does that impress you? Should the candidates be including publications that were not peer-reviewed? What do you think on that, Dr. Hetherington?
Well, I think for a student, I really don't have a real problem with that. And I know there are some things that we have an opportunity at the college to do where students can abstract articles and for a publication, and they work with a faculty member. And the faculty member, and may not be from our school but other areas, write the critique on the article. And they do a couple of about 4 articles doing it, but it does take time and effort, and you can't just throw garbage down, because I'm going to read it, and it better reflect what I expect in that article and that type of. So I think it's not a tremendous thing. It's not like an individual research project that they designed and that type of thing, but it does. Not every student wants to do that, and I think by doing that, it does show that this individual is interested in doing something more than just what was required, whether it's in a non-peer-reviewed journal or, a lot of posters that are put up by students at meetings are not really peer-reviewed. They're done with faculty and attending, so they're good quality there. But I don't think that should disqualify them. It doesn't really need to have to be something that's been submitted for publication or published in a peer-reviewed journal. It's the commitment that they made to do more.
Colleen?
And that's what I agree with, is that it shows an effort. At our program, there is a research project that is a requirement, and to get a research project to publication takes years, in a quality project. And so to expect a student to be able to do that by the time they reach your interview process, I think is a lot. But if they do any research, whether peer-reviewed or not, still shows the effort and, like Dr. Harrington said, the commitment to do something above and beyond just taking a class and passing it.
Other comments, Dr. Yeager? Or is it
I
been said?
totally agree with the panel. The one thing that I would ask the student, though, is why not? Perhaps the person that they're working with is not educated enough how to submit it to get peer-reviewed. It could be a perfectly great article, and that just they haven't gone through the process of getting it peer-reviewed. So I would ask them why, or what's their intentions with this.
Okay, so on that same note then, to what degree do you weight extracurricular activities? You may get a 4.0 candidate and someone who's smoked the boards that have come their way, and they come through the door saying, hey, I am fit. How much do the extracurricular activities, and that could include past work history, how does that impact how you weight that candidate? Can we start with you, Dr. Yeager?
Sure. I think it weighs heavily. In fact, I think that becoming a physician is not only being able to articulate what's wrong with your patient, it's being able to communicate with them on a level that they understand. Studies have shown that patients only understand about 10% of what they tell them, or what we tell them. And so if we can communicate through our extracurricular activities, whether it being, I was a waitress, or whether I was a flight attendant, or whether I was doing something where I was volunteering at a homeless shelter, all of these things actually go towards the whole compilation of a physician. And I think that it's really important for us to, at our residency, we pick people not only on their GPA, which is just one small area, but we pick on their personality, we pick on how well they articulate and work with the staff, we pick on a multitude of different things ranging from their extracurricular activities to everything else. And in fact, on our exit interview that I have with the students with each month, I ask them, tell me a joke. And inadvertently, the students, what do they always ask? You want it clean or dirty? Which I love that. Because, you know, it shows that there's a personality. It shows that they have a sense of humor. It shows that beyond getting to know what they are on paper is a real life person that I'm going to deal with for 3 years. And so that I think that's vitally important.
And Colleen?
I agree. I think the extracurricular activities not only go to the character of the person, but it also goes to a lot of time management too, especially if they're doing that through school. So if they can do that and still successfully succeed, then I think, again, it's showing to the character of the person, as well as their commitment to the community and or something else.
And Dr. Hetherington?
You know, it's sort of like what we were just talking about before in terms of research. What we look for is not just, I was a member of the student chapter of X, Y, and Z. We look for somebody who was actively involved in the leadership of that group, whether it be their American Podiatric Medical Students Association, in my case, the Ohio Podiatric Medical Student Association, our surgical clubs or medicine clubs, the dermatology club, but that they played a leadership role in that area. Because a lot of students will just sign up for clubs and maybe they'll go to meetings, maybe they won't. So you have to really look at, you can have somebody that's been a member of every club in the school, but you know, you can't monitor that, but you can see if they've had a leadership role in the institution. But also, I agree, there's a lot of our students at Ohio that are involved in a lot of community projects, collecting shoes or collecting, you know, food, supporting a center for mothers and their children, you know, that type of thing, community service. In our area, we also have students that are involved in the free clinic. You know, to me, you're doing that on your own time, and that's a commitment. Mm-hmm. So not just what have you done in the school, but what do you do in the community?
Okay, now regarding the nuts and bolts of the interview process itself, if we asked you to just put it in a capsule, how you conduct that interview, is it stratified? Here's an academic, here's a hand skill, and then here's an interview on social background. Can you give us the nuts and bolts of your program, Dr. Yeager?
Yeah, you just hit it right on the head. We actually, every one of our interviews is clinically based. And so we try to understand if the student had seen that patient in the office, so obviously we don't ask them about that during that month. But our interview itself is exactly one clinical case. Now, what's interesting, and we like to do it very similar to oral boards in terms of we go, we have an interview, we have a clinical case, and if the student, not necessarily if they answer correctly, but we want to see how their logical thinking is, and to see if they are thinking in terms of, they might not have it right, but they might deter themselves on a road that is just fraught with danger. I love to say that to them. I said, are you sure you want to go this path? And so if they're thinking logically through the clinical case, great. The second part is I also tell them, ask me, if I'm not familiar with them or I didn't ask them, tell me a joke, tell me something about yourself. That's more of a personal. And then at the final, we don't have them do any hand ties or any of that stuff for the simple reason that during their month with us, we're able to witness their hand skills. And through the evaluation process through the schools, I still remember, and I print those out and put them in their file if their hands were bad or if they were not up to speed or what have you. And if the student can comment on that and say, well, you know, I know during the hand ties, during this case, I wasn't so good. I've improved upon that. That shows me a tremendous amount. And so I think part of being in practice is looking within yourself and always critiquing yourself to make yourself better. And I think as a student, you always need to do that as well because you're always improving. And if the students say, you know what, at the beginning of this rotation, I couldn't suture anything. And then at the end of the suture or the rotation during the month, they're suturing like crazy, that is huge. And so I look for improvement in the month itself.
And Colleen?
So our interview process is 3 people participate in the interview process, other faculty members, and we rotate year to year, me being a constant factor. We always start out with the social questions. So when that interview, when their transcripts come across and the Casper packet, we read everything. And so sometimes they may ask a social question about their personal statement, or it'll still be considered social if I ask them to tell us more about their research, where has it gone to this point, or some type of volunteer thing that they've done. So I consider that still the social. We usually then ask them to tell us about an interesting case that they've had. And sometimes if they say it's interesting, like what's the most interesting thing you've seen on your other clerkships, if it's interesting to them, then we think that they should know factors about it. And sometimes our academic questions come from that. If they don't come from that series, then we actually have case presentations that we will present to them as well. So as my colleagues here had said, a lot of times it's the resident who dictates how well their interview does or doesn't go. Because if you're going to tell us an interesting case and not know anything about it, or even some of the advantages that's come about, then that tells us a lot that you really haven't kept up with it. So it could help you and make you shine, or it can hurt you in the same interview process.
Understood. Dr. Headington?
You know, I think students that do a clerkship are at a distinct advantage in terms of the program. But what about the students that didn't have the opportunity to do that? And actually for both groups, before they start the clerkship and before they visit and before they interview, what I recommend to students is to research the program. And I don't mean, you know, how many triples did they do or how many bunions did they do. I mean, what is this program interested in? What is the heart of this program? Is it a big trauma program? They do a lot of wound care. It's very easy to go to the library and go to PubMed and look and see what kind of publications have come out of this institution. Because you can pretty much guarantee if they've written on a certain area, when you get there, they're going to ask you about it. And you should know, if you want to show that you're interested in the program and you're prepared, you should know about the program, you should know what they're interested in, and you should be able to answer questions in that area. And I think that helps, helps people for the clerkship, and for when they visit and for their interviews. And I think these are things that students can do to prepare before they go to programs. Because you don't have to know everything. You have to be honestly say, I don't know that, but you better know it the next day. Sure. But I think knowing about the program and what their interests is, if they write on a certain area, whether it be Charcot reconstruction or something like that, then I would prepare. I definitely look and see what they've written in that institution.
Sure. Yeah, do your background check. Mm-hmm. So to the residents, do your background check on the program that you're preparing to interview for. Regarding candidates coming in, if there were one category of study that you think that they should have a very strong vein in, whether it's anatomy or physiology, fundamentals of surgery, what do you think is key before they come out to your program that they hone? Which academic vein do you think they should spend the most time at honing? Dr. Yeager?
That's an easy question. I think it's radiology. For the simple reason that, I guess I say it's easy. But now I think about biomechanics, I think about pathology, but I think it's easy for us in a patient's room to go over the x-rays with the patient, with the student and the resident there and ask questions of the students. And so it's easy in terms of radiologically to ask them questions. So I think knowing the radiology, knowing and in turn knowing anatomy for that matter, in terms of how it's relation to the radiology, is vitally important. And going back to Vince, to the other previous question, one thing that I would like to say to students that impresses me as residency director during the interview process is come in and ask the director, how is that patient that we did that month? How is Mr. blah, 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 blah doing? Because that to me shows that you care, shows to me that you've thought about that person, and shows to me that you really, really are interested in the program. So I wanted to make sure that we piggyback, because that is vitally, as a residency director, if you were to come in and say to me, how's Mr. Jones doing? Be like, you remember that? And then that brings me back to that month that they were there, and that brings me back to how he or she took care of that patient and took me back to how well they did. Mm-hmm. And so that to me shows that number one, you really care, and number two, that you care about people. In terms of knowing the radiology, know your radiology. I'm Shoal-friendly program. The Shoal students do wonderful. I have a California resident now. He does great at biomechanics. And so of our biomechanic questions, we always ask him, hey, what do you think about this? And then it's a voluminous biomechanic evaluation, and we love it. So I think diversity within our program is awesome.
Okay, so I'm going to piggyback on one thing. Don't wait, my opinion is do not wait for the interview process to say, how's that patient doing? If you've done the clerkship, that's fine, but if you've come to visit and you spent only a day, you have the resident's email, you have the attending's email, email them like, just thinking about it, how's that patient doing? Because if you don't ask that question, they may think you forgot about it, and does that set you up to get the interview? Okay, that being said, when I think about what I think the strongest thing you have to have is really anatomy, because everything else follows. It's great to read an x-ray, but if you don't know a calcaneus, then that's the features of a calcaneus. So I think anatomy is what sets everything up for the surgery, the biomechanics, the radiology reading, and things like that. So that would be my strongest venue for people to know.
When I was thinking about this, getting prepared for your residency, your clerkships, your interviews, what's the subject you're furthest away from at that point that's absolutely critical? And that's anatomy. And I agree with Colleen, it's the key to imaging and everything else. And I always remember students who come up to me and say, I was in the OR and they pointed to something and they said, what's that? And I didn't know, or I wasn't sure. And I think that happens just about everywhere. And I think so reviewing your anatomy and being up on your anatomy, and there's a lot of tools to do that. You don't need textbooks. There's a lot of great stuff on the internet and everything else that you can shine on your anatomy, because it's been a while since you really were in the anatomy lab, and it's a little bit different now. And I think that will strengthen you for all of the experiences.
Okay, so we can agree that a strong academic vein in the category of anatomy will facilitate you through all other categories of medicine and surgery. What do you think about awareness of the current literature? Residents or medical students have so much work to be done academically, trying to get out, rotate at facilities. What do you think about it when they walk through the door and they haven't seen the latest issue of Journal of Foot and Ankle Surgery or JAPMA?
There's not, with the way technology is and they have easy access to it, they may not have read the last or yesterday's version, but they should know what was out there. And so I think that there's not a lot of excuse for not reading up on the literature. Because even if they're coming to visit, there's a case, there's a surgery, or what have you, that you should still be looking up what some of the literature has to say about it. Dr. Yeager made mention of their Tuesday morning Journal Club. We have every Thursday morning as a podiatry indications conference where we present a case with the most recent literature. And it's not that the students are rotating with us don't know about that. So we expect them to know about it.
And Dr. Hetherington?
There's a lot of literature out there. And, I'm not so sure that it's necessarily that you read the Journal of Foot and Ankle Surgery every month and you read the Journal of the American Podiatric Medical Association. There's a lot of literature out there. What I do is I encourage students to read, but what I encourage them to do is, you're in clinic and there's an interesting case. You can electronically find a lot of material on that. You can find it in peer-reviewed journals. You can download the journals. You can keep it in your computer or on your iPad or whatever you're using, your tablet. You can have it for, of course, read it. Don't just harvest it, but
right.
Read it. And you can keep it in a file for future reference. So every week, you could always be reading on a new topic. And, and again, I'm not saying, usually you're looking at the current literature from that standpoint. So I encourage students to read more and to read something that's of interest to them, because when students come to me and they say, what should I be reading? And it's what I'm interested in may not necessarily be what you're interested in or what ties into your education right now. So I think, reading is very important to build a knowledge base. Whether it's just focusing on our literature is not necessarily that important to me.
The technology has really ingrained itself in our culture. And the students now are becoming very reliant on technology for access for fundamental information. Are you finding gaps in their understanding with regards to just not only fundamentals of the academics of medicine, but in surgical aspects of what we should be preparing for residency? We're Googling and we're getting online information. When you're doing the interview process, do you twist your questions in a way that to find out, hey, do you really understand the fundamentals, or are you living online, or does that even make a difference these days?
Absolutely, Dr. Judge. As the last question, what I was going to bring up is not necessarily the latest literature, but the classic articles, I think, are key. Because without knowing the classic articles, how can you go forward with some of the newest technology? Because you can compare, well, they used to do cross K-wires for this. Wow, whoa. Okay, now we do this. And so now if you never knew what they did in the past and had a baseline, how can you see how much better this technology is? And so I think knowing the classic articles are important. I think that now it's funny because I'll ask a student a question and they don't know. And students, if you come to my program, don't guess, because that drives me crazy, okay? Guessing just wastes my time and your time. And if you get it right, you guessed. You didn't learn anything. Also, do not whip out your phone and try to get the answer there for me. That does nothing for me. I can do that too. I have a cell phone. I can do that as well, okay? What I like is if you don't know the answer to a question, you look it up, you bring it out next day, and you bring it in to me. And so Googling the answer to me or using the technology that we have, is that really learning? Is that really articulating, or is that just spitting out what I want to hear? It's not. If you take the time to write it down and present it to me rather than reading off your phone, I think it's much better.
Dr. Hetherington?
I think these types of things are learning tools, but they're not to replace what you need to know. I mean, you can find a lot of electronic journals, textbooks that, that are very good reputation and everything. You can find them electronically, so, they're right at your fingertips when you need to look something up or you need to learn something. But I don't think it's the type of thing that it should be where, well, I don't really have to learn that because I've got my cell phone. I can just look it up and let you know what the answer is. Well, when you're in the operating room, you can't go, excuse me, I need to get my cell phone. So you need to understand and comprehend this material. And the cell phone, the tablets, the computers are tools to allow you to learn. But it's the learning that needs to occur, and not just say, well, I have availability to the material. No, you need to know the material. That's a tool that just helps you find it.
Now, do you think that for your candidates coming through the door, if they have not had hands-on surgical skills, can you feel them out for that during your interview process, or may you be blindsided by someone who truly isn't experienced?
It's a great question. Generally, with the students that come through us with a month, we have them do some type of, whether we have a cadaveric workshop or whether we have them do hands-on suturing. And so we are able to really see if they have problems with their brachial plexus. Part of being a residency director, however, is taking them from that point where my first-year residents always call it the earthquake effect, because the first time they pick it up, there's like an earthquake, to the point where after their 6 months of being with us, that we've done so many cases that now they're confident and they're throwing sutures and what have you. So it's part of my job as residency director to take them from the earthquake and get them to the point where they're confident enough and the ability to throw that screw or to fix that ankle fracture or to do that type of stuff. That's my job. But they have to work together to do that. And if they can't practice, then they're not going to be able to do, and I'm not going to be able to hand over the knife to them and feel confident about that.
So for the people who rotate through our clerkship, that's what we consider one of our C's is the competence. And it's the competence with your hand skills, or even the competence to say, I don't know that answer. Knowing what you don't know is part of the competence. Could we be blindsided? Because we don't do any dexterity tests when we interview. Could we be blindsided? Yes, but that's a person who's actually going to do, you know, you're going to set up a suture workshop so they have extra access to that. And like Dr. Yeager said, that's part of our job as a program, to try and take you from not understanding the concepts of hand skills or being able to perform them well to being confident with what you do in the OR.
Regarding most information anymore is available online to include clerkship manuals that may be published online. Can we say across the board that that information is available for your programs?
Yeah.
It is.
Of that information, are there any holes or are there any weaknesses in the program manuals that exist today? So when a clerk comes, are you finding there's a gap in the information clearly, or some element that the potential residents may misconstrue? So are you thinking that you have a clean machine with regards to your protocol that's written and published online? Dr. Yeager?
I actually proofread and submit that. So it's my fault if there's a fault there or a gap. I love having these students come in because they ask questions that might not be included in there. So I think as residency director, I'm approving everything that's written about the program. And so if I can add things or take away things that I might not be applicable, I'm always changing that document. I think that's why it's important to come at least visit or at least spend a month, so that if there are holes that are not being able to say on one sheet, that you can actually ask. Because there's a lot of benefits of our program that I necessarily cannot add on there.
Our manual, our clerkship manuals, made available when we find out who's coming to our program. It's directly emailed to them, but it's also on-site available through the school. And it's pretty comprehensive just because it is a mandatory rotation, and we've been having people come in and rotate for, 30 plus years. So it's been updated as it goes along. So I think it's pretty comprehensive.
Our clerkship manual, like we have a syllabi for the medical rotations, our clerkship manual is pretty generic about what the expectations are, behavior is. And I think many of them are based on policies and procedures within the institution, either the responsibility of the school or responsibility of the hospital. I don't know of a lot of programs, and then again, I don't read a lot of clerkship manuals, because they're usually sent or out by the institution or made available by the institution, that really have anything that says, you're going to be with us for a month. Here's what we expect on day one. I think that's a gap in a lot of clerkships. And, I encourage my students to call the programs, call the resident in advance and say, what do you expect me to do when I'm there? Am I going to be required to do a total history and physical exam day one? Or, what skills do I need on day one, minute one when I walk in the door? And I think that's important. I think there's something else when you talk about an individual's skills, manual dexterity, and that type of thing. You have to look at the entire continuum of the training process. And a student that's in their first month of clerkship ever is going to be a lot different than that same student 10 months later after they've had 4 or 5 clerkships under their belt. So I think there's a lot that you have to weigh in judging the performance of an individual student. I just wanted to make that point on it. When you say, well, what about their manual skills? Well, it's the first time they've really been in a clerkship in that environment, in a hospital, with residents as part of that podiatric medical team. I mean, they're not sure what's expected of them. They've had, what a lot of the schools offer in terms of suturing experiences. It could even be, if they've had their emergency room rotation and they've been putting in tons of sutures, they're going to be different than the individual who just walked in the door and hasn't had that opportunity. So I think you have to weigh certain of their skills based upon their experience.
And we actually have the students contact our residents, and we have a PowerPoint presentation that we send to the students, giving them everything that they need. And piggyback what you were saying, Vince, in terms of having the students, I tell them on their exit interview, if you are truly interested in my program, come back and visit. Mm-hmm. If you come back and visit and you improved on, because they don't think that I remember things, but I remember things. If you improve on your suturing skills, that's a definite bonus. And evaluating yourself and looking within yourself to see what you need to improve on is huge. And so if you come back and visit, that's number one, shows me your level of interest, and number two, sees how improved you are. You hit it right on the head. That's a good point.
Okay, so our time's getting more narrow now, so we're going to start moving a little quicker. With regards to the ranking process, number one, and just briefly, is it a sole person who does the ranking of the candidate after they've gone through your interview process, or is there a team that puts their heads together to determine what the ranking is and how you select your residents? Dr. Yeager?
There's a team. Myself, the first-year resident who also attends the residency interview process with me, and our residency coordinator, we are the team that makes it up. But we go down to Texas or wherever we're going to be at Cripps with a list of how we are going in to rank them. However, there have been times, in going on 3 years now, that every single time we were surprised.
Sure.
So it's a team for us. I come back with a preliminary ranking, and then I sit with all the other attendings as well as our residents, the people who the future residents will be working with, and then we ultimately decide the final ranking.
It's definitely a team approach. My role is more to help coordinate the process, but the people that really know and the applicants and have had an opportunity to work with them are the clinicians and the people from the hospital. So they're the people that actually rank or provide the input on the individual candidates, and they're the ones who actually are responsible for. It's their information that the ranking occurs on.
Okay, so if the ranking process is considered 100% of your tabulation, what percent does the residents' input equal in your residency program? So when the residents weigh in about a potential candidate, how heavy is their input weighted? Dr. Yeager?
About 50%.
That's huge.
It is.
That's an important thing. So when you're rotating, you know who you have to shine to.
It's enough to take someone out of a ranking if a resident is feels that they cannot work with that person. Because I feel like when we pick future residents, we have a chemistry that we know we all work together. So if someone's saying they're not going to fit our team, that weighs a lot. And like I said, it's enough to take someone out of ranking.
Dr. Hetherington?
Well, I think that they don't have a huge role in it, but they would have feedback through pretty much the hospital experiences where they've rotated with the students, and that would be through the hospital. We don't really have them as members of our selection team, but any feedback or difficulty they'd experience with the students, it's, and positive experiences, we usually hear that from them. And that's just one more area or one more piece of data that we look at to say that's a positive for the
Right.
student.
Okay. If you looked at the clerkship or the rotation at your program as stage 1 to your interview process, how many stages are at your interview? Do you have callbacks? Is there a second round? Is there a third? Is there a process of elimination and you get a small select group that you interview? Dr. Yeager?
Absolutely. We do callbacks for the simple reason of narrowing it down. Having two positions, let's just say for round numbers, we have 20 applicants. There's 10 that we are very serious about. We want to actually see, I feel as though the callback takes it to a different level. Because now the student knows that they're in the running. And so now the callback gets down to the nitty-gritty. We've gone the academics. You tell me, and I tell them that, why should I choose you? That's my question. Why should I choose a resident? And I actually tell, believe it or not, I have told students that I absolutely love, that I want them to be a resident. I'll say, listen, you're going to get a call back. I'm going to ask you, why should I choose you as a resident? And I'm telling you right now, there were a couple that did not know how to answer that question. So to me, I'm giving you a layup. Okay? Slam dunk it, right? Didn't take the time to answer it, whatever reason, that shows to me that you are not interested in the program. So the callback to me just takes it to a different level and a little bit more serious about the program.
We have no callback at my program.
I mentioned before, we don't really interview with our candidates, so we don't have a first interview, so we don't have a call back.
Sure.
Because our program's familiarity with the students that are applying from the college, I mean, their interviews have been months in our clinic and time at the hospital, month at least or 2 months at the hospital. So a 15-minute interview really isn't going to do a lot.
Sure. Okay, so this wouldn't pertain to you then, Dr. Hetherington. With regards to the unmatched portion of the program for the CRIP, what is your advice then to those residents who go unmatched?
Contact the programs that have an opportunity to offer you a program.
If your program is not matched, are you encouraging people who did not match, and will you scramble to take someone, or would you rather leave that spot open?
I am so glad you asked that question. Last year, we had one spot that did not match. We chose a student that did not match from the previous year. Very high on him. He sat and told me, I want your program. I'm ranking you number 1. I, in turn, believed that, ranked him number 1, found out that we did not match. So to me, that is the biggest thing that will drive me crazy. Because I'm going to tell you right now, and I tell students, if I like you and I'm going to tell you that I rank you, you do not have to tell me where you're going to rank me. Okay, that's illegal. But I'm going to tell you where I'm standing. And I am going to tell you straight up, this is what I'm going to rank you. So please do not lie to me, because then I end up in a scramble and I will remember your name.
Sure, sure. Yeah, integrity matters. So that's not fair to the residents, it's not fair to the director, it's not fair to the program or the hospital. So yeah, we've seen that time and time again, so it's a shame, but happens. Now, Colleen, would you entertain taking in someone who's unmatched if you did not match yourselves?
Yes, but we did not go through the match part 2, but I also believe in that system. And so I don't know how it would work out, but if it was taking somebody who unmatched, absolutely.
Okay.
I feel like we would take the best candidate.
Yeah, so I believe a lot of people work very hard to place candidates that go unmatched. As we wind up this interview now, what is the final mention, what is that final note that you want the residents to hear, that pitch-perfect suggestion to them as they prepare for their interview process? What's the final word for them, Dr. Yeager?
Be personable, be real, be educated, be articulate, but also realize that as a program, I need you just as much as you need me. So going forward with that comment does not mean that you have automatic attitude that you need me. No, it's working together. It's being personable. I would much rather have someone that works their butt off than someone that is lazy and brilliant.
Sure. Mutual respect matters.
And that would be my feeling, is that any resident that we take, we're taking you on as part of our team, not just a resident to be. And if I can say one thing, is let the system work. Let CRIP and the match do its job. Be fair to yourself and run the gamut. Don't drop out because someone offered or suggested that you had to. Let it run its course, and I think you'll be fine.
Yeah, I think, it came to mind when you had just mentioned about students that are unmatched. And from a different perspective now, not from residency director, but dealing with unmatched students. And when I sit down and talk to students, there's a couple of things that I think students need to realize. Is how competitive are they? There are some very competitive residency programs in the country. If you are not one of the highly competitive students, if you apply to it, that's okay, but you better have an idea of, where do I fit in this? I really want this program. But sometimes what we see is students that, one, don't apply to enough programs. They don't go to enough interviews. They limit their geographic choice of programs. And because of that, they get into a position where they have so few choices that it's very difficult for them to be matched. You know, what I advise the students is think about it as, you know, the programs you really want, the programs that you're interested in, and then they have a third level of programs that are programs that would be, I could really, you know, I could do this residency program. But I think, you know, some students tend to really limit their opportunities. And it's not always the students that we were saying that are the lower GPA. Some of them are very bright students, and you just can't figure out why they made those choices. I'm not going to go to, I can only think, excuse me, in the Ohio area. Well, think about it. There's a lot of programs in Ohio, but there's a lot of applicants in Ohio. And I think that there are a lot of other errors that are made, and it's probably a time for a different topic at one time, you know, just to talk about errors made in the application process, in preparing the application, in preparing your personal statement, in limiting your options, and limiting yourself geographically, and other issues that all play into this situation of an, you know, as it's very important for the students to understand. You know, when you don't match, it's not necessarily because you're not qualified. It's you restricted your opportunities, and that's something that needs to be
Students have more
addressed.
control than they know. So don't let geography limit your opportunities in interviewing. One final question then. With regards to those unmatched applicants, what is your advice to that applicant on what they should do during that next year to improve their opportunities in the interview process for the subsequent year? Your comments, Colleen?
Stay somehow active in podiatry, whether it's participating in the homeless shelter, whether it's working with the facility and doing research, but still staying active with podiatry, I think shows a lot of incentive. And still, during that year, start visiting the programs that may be of interest to you next year when you go to, you know, go through the interview process again.
Well, Dr. Hetherington, how realistic do you think it is for someone who went unmatched to show up your door and say, hey, I want to participate in research with you?
Well, actually, we have a research opportunity for unmatched students at the college. It's matching funds between the college and the APMA. And this year we did take a student who was unmatched the year before who did our research fellowship. When I look at this, I agree with Colleen. They need to have stayed within the profession and kept active. There's a reason they didn't match. And if it's because they went about the application incorrectly, you know, they applied to 3 programs, and that they can fix easier. If there was another reason, perhaps their clinical evaluations, or maybe they just don't interview very well. They've identified what those weaknesses are, and they've done something to address those weaknesses. And I think any type of work that they can do in terms of writing, scholarly activity, research, being, again, as Colleen said, active in the profession, and visiting programs is the way to get back into it. But identify what the error was, identify weaknesses, you know, fix those weaknesses. I mean, at the college, we would help any student from that perspective, you know, getting back into the match again and trying to help them with whatever the problem was. And some are very good students, just made a bad choice in the application. And others struggled with certain areas that need to be, you know, identified and worked on.
Sure. Dr. Yeager, final thoughts on that?
Yeah, I agree with Colleen in terms of staying active, because you have to keep your skills up to date. I think one thing, though, I would recommend for the students that unfortunately don't match is keep in contact with the residencies that you love. Contact them and say, can I, you know, hey, Dr. Hetherington, do you have a moment to speak? I know that I was number 3, and I know you have 2 spots. I know I didn't match. I would love to come to your program. That, to me, puts my feet to the fire and explains to you, the student, why you didn't match. And that says to me, wow, this student really wants to come here. And so I don't have a problem with the student contacting me via email or via calling me and just saying, you know what did I do wrong during the interview? What can I improve upon? And I would love to be your resident next year. To hear that from a student out of their mouths goes miles for me.
So follow up of your own interview process. You do have more control than you know on the outcome and what your future may bring. So I truly appreciate your time and attention. and the faculty that we had today. It's been an honor and a privilege to work with you today.
It's been a pleasure.
Thank you.